Okay. Hi, everyone. I hope I'm live. We're live. Okay. Yay. Welcome, everyone, to our discussion this afternoon about the modern HIV storyline innovations for TV narratives. I'm Kate Folb. I'm director of Hollywood Health and Society, which is a program of the USC Annenberg Norman Lear Center. We are a program that provides free information and access to experts and people with lived experience for writers and producers and other creatives to help ensure that their depictions around health and medicine and science and safety are as accurate as possible. Our services are pro bono. We don't take a credit. We don't take a fee. We're just here to help you, the screenwriter, get it right, so to speak. So we're delighted today to be hosting this panel. We're in partnership for a long effort, not just for today, but for an ongoing effort with ViiV Healthcare around new innovations of HIV treatment. And of course, along with that goes prevention and information and all the rest of it, stigma reducing, and all the things. So we're excited to be here today. I have a fabulous panel that you're going to be amazed at all the things you learn, and I'm going to introduce them in just a minute, but and we're going to put their bios in the chat so I don't have to go much beyond their names and titles. But I wanted to start with kind of the history of HIV on TV. And because I've been in this world a long time, and early on in my career in the 90s, in the 1990s, I began working with the entertainment industry on the topic of HIV. Of course, that was right in the midst of the AIDS crisis. There was so much misinformation, misunderstanding, panic, fear, stigma, all the things that it was really important that Hollywood storytellers help disseminate the accurate information around HIV transmission, prevention, treatment, etc. And so I've been doing this work on the topic of HIV for a long time. Back in the day, some of the earlier characters on TV that were featured as having HIV, Gloria Rubin on ER. We did lots of work with the TV show ER on HIV in general, but also eventually created this character who was a physician assistant, later became a doctor, and she was HIV positive and well as well. So it gave us a lot of opportunity to have conversations around that. Also, a show called Life Goes On, starring Chad Lowe. He was also one of the first HIV positive characters, and they really flipped that one because at the time the stigma was it's white homosexual men who are the ones that are carrying HIV, and this was a white heterosexual man who was HIV positive. So again, it gave us an opportunity to have lots of different conversations about it. And then, of course, The Bold and the Beautiful soap opera had a character, Tony, who had HIV and who, for I think years, he was a popular character on the show, and we knew that he was HIV positive, and so there were lots of opportunities to have those conversations. So those are some early ones. There might have been a few before that. I think even Saint Elsewhere, which was an earlier medical show in the 80s, might have addressed HIV right toward the end of their season or their series. But at any rate, so we've come a long way in terms of storytelling. And just to give you an example of how far we've come, back when I was doing this work with ER and even before that, um, there were, I don't think they were strict rules, but there was fear in Hollywood to even say the word condom. Like, that was like the networks would not allow the shows to say the word condom, which seems so silly now, but that's what it was in the 90s. And now if you drive around Los Angeles, you see billboards of giant inflated condoms with talking about getting tested and safe sex and all the things. So we've come a long way, but one example is an episode of Everybody Loves Raymond where it wasn't about HIV. It was just that Raymond's wife decides she's tired of being the one in charge of birth control and she wants her husband to take over. He chickens out as far as getting a vasectomy. So he comes home with a big box of condoms, but they can't say the word condom. They had to call them the things. So through the whole episode, if you go back and research it, they're saying, "Oh, you brought home the things." And they kind of, I think, because the network was preventing them from saying the word condom, they kind of accentuated it even more for comedic value. But I mean, that's not that long ago that the networks were afraid to address even the word condom, much less some of the other issues that surrounded HIV prevention, safe sex, talking to your partner, getting tested, all the things. Designing Women was another earlier show that did a powerful, powerful episode around HIV with an amazing speech by one of the lead characters. So we've worked our way. We've gotten past. We can now say condom on TV. We can now talk about getting tested. But it took, a decade or maybe even almost 2 decades. But in more recent times, Hollywood Health and Society has had the pleasure of working with the show How to Get Away with Murder, Shonda Rhimes' show, um, which had a whole storyline about a couple who one is HIV positive and one is negative, but they go through the whole process of getting tested and being nervous about it, and that was an opportunity then for us to start talking about PrEP and other kinds of preventions. The medication that a person who's HIV negative, but maybe is in a relationship with someone who's positive, can take this medication and it will prevent them from um, becoming HIV positive. So that was a new medication that came out, and we were excited to be able to address that on How to Get Away with Murder. Also, I think Grey's Anatomy has done some, so we're seeing it. But there's definitely been ebbs and flows in terms of the subject, and that sometimes has to do with political climate. It certainly had to do with political climate in the early years. And I hope that's not the case now, because there's lots of opportunity for storytelling in the future, and that's why we have this panel. So I'm going to stop blathering, but I want to end my blather with the show Empire, which was also just a few years ago, around the time of How to Get Away with Murder, I think. And Empire had an amazing storyline as well, about HIV positive. One guy in the couple is positive, one guy is negative. And again, we had a chance to learn about PrEP and testing and all kinds of things. And so I want to introduce JaNeika and JaSheika James, who were writers and executive producers on Empire and also more recently on Bel-Air. But we want to talk about Empire first and foremost. But welcome, JaNeika and JaSheika. So glad that you're here with us. And can you give us kind of the background of how that storyline came about and why you guys decided to do it? And did you get blowback and all the good
Oh,
things?
absolutely. We have lots of stories. Thank you so much, first of all, for having us. It was really cool to just actually listen to you talk about just the history. And as you were talking, I was thinking about my first introduction to a character, HIV positive character, was through General Hospital and the Robin Scorpio, falling in love with Stone, and Stone died of AIDS, and Robin is an HIV positive character who still exists, who still live. You know what I mean? So it's wild how, this part of storytelling kind of ebbs and flows between, like, what we're getting pushed back on, and how it's coming about. And, just to take you guys through a little bit of our experience at Empire, we always knew, I think, from the beginning of the show that we wanted to have a story about HIV. It took us until season four, five. Was that season? That was season four. Four? It's five.
Oh, five.
It's
You're
five.
right. You're
It's
right.
five. It took us until season five. We had six seasons total. It took us until season five, but from the initial inception of the show, we wanted to tell this story. Um, and it's interesting because even just as you were talking about, the different characters and main characters that HIV storylines have been able to feature, even us telling this story was a battle to get it up.
Battle.
But even in the deciding, through which
character.
character, we did have pushback, like, well, it can't be one of our main characters. And we're like, well, why not? You know what I mean? Like, so we introduced a character, Kai Givens, who was a love interest of our main character Jamal. And one of the things that I thought we were really excited about was to bring the audience to fall in love with this love interest for him, who ultimately ended up becoming his husband in the series. But over the course of, I think, like a two-part episode, 4 and 5, 504 and 505 of Empire, we told this story of this man that he fell in love with, and when they were first falling in love, and Kai's fears of, letting Jamal know that he's HIV positive, and the beauty in Jamal's response to that. Okay, I'm HIV negative, and I plan on staying that way. And like, what is that? You know what I mean? Like, that's not going to stop us from, exploring this relationship. And that was, something that we were really keen on showcasing.
Yeah, I mean that's a quite a departure from the early HIV stories where it was like, oh my gosh, and then it was like this death sentence and a whole dramatic thing. It was now we're at the stage where it's like, and
the radical acceptance and love, which was great in the first part of the episode. And then we went into our episode, which is 505. Kai had been injured covering, he's a news reporter covering a story overseas, and they finally found him and he came back home and he was in the hospital. And while they were in the hospital, Cookie, played by the lovely Taraji P. Henson, overheard a doctor talking about Kai's HIV status, um, and freaked out when she heard it and brought it up to her son. And one of the, I think the beauty of being able to tell this story is that, there's a large swath, variety of people in our audience, some who are aware, some who are educated, some who are completely ignorant to, what's going on, in that world, what's available, what's not available, and the biases and the stigmas that come with it. And we really wanted to take an opportunity through several characters to really explore various perspectives and take Cookie on a journey of learning about, HIV is not a death sentence, and it was really cool because
Educating her about PrEP,
educating her about PrEP and the effect that it had, not just on our audience here, but also globally. It was a very important story for Jussie Smollett to tell. I always like to tell this story. He's been an advocate and, I think done a lot of service work with the Black AIDS Institute led by Phil Wilson for years, I think since he was in high school. And so it was really important to do this story for him and to do it right. And one of the things that he was able to share with us through, several people who worked and, the trips that they were doing, to Africa and to South Africa, how they would talk to women at clinics that they were visiting who were fans of Empire, watching Empire, who had actually learned about the drug PrEP through our episode and learned that, like, not only is it something that, men can take, but we can take it too to protect ourselves. Now, I just really was really excited about just how far reaching, something that, very important to us as storytellers in TV, but thinking about how its impact in educating audiences globally and across the world about just different ways that, you know, they can protect themselves and different prevention methods. And you know, as you were saying earlier, Kate, we How to Get Away with Murder was on at the same time. And actually we learned about PrEP from watching How to Get Away with Murder, you know. So it's and you know, thinking about how important and how effective that storytelling was, and just how, I guess, you know, even now, you know, it kind of ebbs and flows in terms of, you know, like the ability to tell those stories, and how we're going to tell those stories. But it's something that we're continuing to kind of work on, and the different stories that we are involving ourselves in currently.
Well, and after this panel, you're gonna be so inspired to get out there and write a whole new thing on some of the new developments we have. But thank you so much for that. It is really fascinating and something we have to remember as writers and producers. On those of you in the audience know this better than I, but that your show isn't just usually, and especially with streaming now, it's not just exclusive to the U.S. anymore. They go, you know, places you don't even know that they're out there. And so it really can have such a greater impact worldwide, in addition to the impact that it's had here in this country. So thank you so much for sharing that. I want to introduce the rest of our panel, and thank you for your patience while we sort of talked about some of the history. But we have with us Dr. Alftan Dyson, who's a PharmD, and you're going to have to explain what a PharmD is, and head of U.S. Strategic Medical Partnerships at ViiV Healthcare. We also have Randevyn Piérre, head of U.S. External Affairs at ViiV Healthcare, and Bithiah Lafontant, head of U.S. Enterprise Communications at ViiV Healthcare. And I'll tell you that we had this team come to our staff at Hollywood Health and Society when we first began our partnership. And they kind of gave us a primer on all the new things and everything HIV related. And it was so fascinating that we just said, well, we just have to do just this for our writer community. So it's basically, for those of us on my staff, a little bit of a repeat, but we can always use that. But very, very fascinating. So thank you all for being here and for our partnership. But can you tell us what's changed? And maybe Dr. Dyson, we'll start with you. What's changed in HIV prevention and treatment in recent years, probably from when Empire, How to Get Away with Murder was on the air? Because frankly, I don't know of another HIV storyline after those two, and talk about ebbs and flows, which is why we want to get back to the flow. So Dr. Dyson?
Yeah, sure. So thanks, everyone. And thanks for having us here today. I'm super excited to be able to come on and share a little bit. I think, you know, and one, I'll say, I remember seeing the episodes and seeing the episode and being so excited, like, oh my gosh, somebody sees me, somebody sees the work that we're doing. This is fantastic. And so it's so full circle moment to be able to hear you all today and hear kind of the vision behind it and what came out of that. So thank you all for that, for uplifting it. I would say in terms of what's changed, you know, we've gotten to a place in the HIV epidemic where we now see folks being able to be in care and, you know, be able to see kind of that a stabilizing, if you will, of new HIV diagnoses. But and that's better than an increase. But what we are still seeing is a disproportionate impact of HIV on certain communities. And I think going back to some of the things that we talked about, people who are not aware, like, you know, there's just a broad range of what people know. One of the big things around care that has changed is that we have new options for both treatment and prevention, and particularly options that are long-acting injectable options. And so the reason that's so fascinating and such a great thing to now have in our arsenal and our toolbox is because, as you talked about earlier, we had folks who would take medications and it would be multiple pills, multiple times a day. And then we got excited when we got to one pill once a day. And now we're in a place where we can say, there's no pills. How about just take an injectable option both for treatment or prevention, right, every 2 months. And so that is something that I think is super fascinating, super exciting that we now have as an option. And then even looking beyond, what could it look like to have longer dosing intervals is something that we're also on the horizon and looking at. And so I think that's really probably a big shift and a big change for people. I think another piece is, this idea of treatment as prevention. So we always talked about PrEP and PrEP as an option, as a prevention option for folks to be able to take PrEP. But what we also know is U equals U, right? And so undetectable equals untransmittable. And so folks who are in care on their medication, who are living with HIV, but in care, engaged, and actually able to access and receive their medication and get to an undetectable status, they cannot transmit HIV to their sexual partners. And this has been proven, right, with data. And so I think those are some of the things that are still are available, things that we have, but are still not widely known always to the community. This idea of long-acting injectables for treatment and prevention, but then this idea of U equals U, right? And that if I'm in care, if someone's in care on medication, they can't transmit HIV to their sexual partners. And so those are probably three big things that I would say are exciting. We're in an exciting time, and something that really needs to be highlighted and is out there is something that we've made some advances, and we've come a long way. So, yeah.
Yeah, I remember doing a panel many years ago in the early days where I think I had a person living with HIV come and sit on the panel, and he brought in this jar filled with pills and said, "This is how much I have to take on a weekly basis," or whatever it was. And it was stunning. I mean, it was just absolutely stunning to think you must all day long just be taking pills. And so to go from that to an injectable, you said every other month or every 2 months,
Yeah,
that's
yeah,
that's huge. That's really groundbreaking.
yeah.
Bithiah or Randevyn, do you have anything to add to that, or I'm going to go to the next question?
Yeah, I'll just add one thing, and I think Alftan really is exactly straight on. There's been so many medical advances really over the past 10, 15 years. We're 15 years out from PrEP, U equals U celebrating its 10-year anniversary. So we've really had this amazing period of change. And right now we have all the tools we need to end the HIV epidemic. That's the reality of it. With a combination of highly effective prevention and highly effective treatment, we should be at a, zero incidence rate, but we're not. And one of the primary reasons that we talk about, and I think that's a thing to also talk about, what hasn't changed along with all these advances is the fact that the people who most need these advances, the people who could benefit the most, are the least likely to be aware of them. That's why I love that you all learned about PrEP from watching a TV show, but it's also terrible, right? That's what it took. That's not something that people's providers are talking to them about. It's not something they're learning about in school. Like sex ed in school today, they don't talk about HIV if they even have sex ed. So I think a lot of the educational opportunities that were once there to educate young people about HIV no longer exist. I always say it's kind of one of those like just kind of disturbing anecdotes. I do a lot of work. We go out in community. We're at one music festival in Atlanta. I cannot tell you the number of young people I talked about who did not know that HIV was still a thing. Like it's something they may have heard about, and they think it's something like didn't we cure that? Isn't that over? People do not know that it's even a thing. So you're thinking about preventing pregnancy, you might be thinking about other STIs, but HIV isn't even on people's radar. So I just want to note that. I think that's the dichotomy. That's really what we face right now is that we have all these tools, we have everything we need, but we have this huge awareness gap, particularly when we think about the communities that are most vulnerable. And HIV has changed. 20% of HIV cases are in women. The majority of HIV cases are in people of color. They're in Black and Latino people. So the kind of what people think about HIV is not necessarily the same. And so the perception has not caught up with what reality is.
Yeah, I want to, and Randevyn, I don't know if you have something to add, but I just wanted to point out that in the chat, we've posted 3 tip sheets that we have developed for writers to utilize. You can link to them and download them. And one is a timeline that sort of shows this timeline that we're talking about. which is very interesting. And of course, it doesn't cover everything. I mean, I was like, can't we fit the story of the AIDS quilt in there somewhere? I tried to keep it to 2 pages. So anyway, but interesting timeline, and then some information on treatment and prevention. So those are handy resources for writers. Please take advantage of them. And Randevyn, do you have anything to add to in terms of new prevention and treatment?
Well, I think the only thing I would add is that to Bithiah's point, there's a lot of lack of information. There's a lot of willful ignorance as well. And even in situations where people may know how HIV is transmitted, they may know that treatment exists, they may even know about PrEP. And yet, conversations about sex and sexuality, HIV itself, and also vulnerability, it remains taboo in a lot of families and a lot of churches and a lot of communities. So, part of the question is what happens when the most likely piece of information that's going to save somebody's life is the one thing that nobody is really allowed to talk about from a cultural perspective. So it really puts us in a position where we have to think, when HIV is no longer the greatest threat, it seems that silence is. It's not good enough to have advancements and innovations in science when there is still a culture of silence, a culture of shame, a culture of stigma. And for many Black and Brown communities who do have the information, the barrier is not lack of information. It becomes a silence that's created by all of those things. So it's also
Yeah.
something to keep in mind as we're telling these stories.
Yeah, that's very interesting, and it's funny. It's not funny. It's interesting that it's still a concern because, again, back in the day, I did a billboard campaign aimed at young people to get tested, and again, this was early 2000s or maybe late 90s, and we did it in both English and in Spanish. And the English one aimed at young people was, go get tested, call this number, whatever, and hey, bring a friend, because we knew from our research that young people felt more comfortable going to get tested if they had a friend with them. When we translated it into Spanish, the community said, oh no, I'm not going with a friend. I want to go across town where nobody's going to know me. And so we had to just change that language on the billboard to just say private and confidential or something like that to ease people's concern. So even that, we learned the stigma within certain cultures that, that was not going to work. Of course, all the other, not talking about sex and not talking certainly about HIV in the household. I think, as you said, it's still a thing. It's still very much a thing, and that's an area where the media can help because we can model, as Empire did and as How to Get Away with Murder did and other shows. You can model having those conversations and showing people like, yes, he's HIV positive, and as if it's not some big horrible thing. So some of those stigma are still here, and certainly within certain communities. Along those lines, in terms of stigma and misunderstandings and misconceptions, I think that's fascinating that some people say, "Oh, I thought we cured that already," or "I thought that's over." Are there other stigma or misconceptions that we see in the media or that you see out there in the general public that we want to raise awareness of and maybe correct for in the media? I'll let anybody jump in who wants to.
Yeah, well, I'll just add that I don't think we have any lack of stigma. I mean, I think it's our biggest challenge yet that we have to tackle. In people's everyday lives is where it really shows up the most, more so than in media. I think by the time we see it in media, it's sort of an overcast of what folks have been living and experiencing day in and day out. Even if we look in Q plus communities in the dating culture, one of the things that we see on a lot of dating apps that we know is a recurring theme is folks who are describing what they're looking for in their ideal partners, whether they be sex partners or whether they be folks who are looking to date more seriously. The caption "No fats, no femmes, no HIV" is very, very popular, and it is a dehumanizing reality that we deal with in communities from day to day. I think Um, there's also stigma, as I said before, that in faith communities, faith can be both a shield and a barrier. In a lot of Black and Brown communities, faith institutions are, we know, among the most trusted and influential spaces. They provide hope, they build community, they support healing, they reduce isolation. They've been responsible for folks' transformative experiences, whatever that looks like for them. But they can also reinforce shame around sex, around sexuality, around HIV, especially in as a punishment of sorts for people's behaviors, is the way it's seen in many cases. And um, even in identity, there's shame and stigma around identity. And these difficult conversations are often avoided. And the tension between faith and love and acceptance and belonging really remains one of the most powerful, and I would venture to say the most unexplored HIV narratives. And so for me, just what comes to my mind, the storytelling question there is more like, what does a person do when the community that saved them is also the community that they fear being truthful with? And it is, um, it's a lot to contend with. And then the thing I'd add to that is, in terms of stigma and the way that people see themselves and experience their lives, is poverty, right? We don't talk a whole lot about that, but that creates that carries its own stigma long before sex even happens. HIV is often portrayed as a story about individual behavior and choices, but for a lot of folks, it's also a story about housing, a story about transportation, healthcare access, employment, survival, how they see um, their own worth. Are they worthy of wellness? And how do other people see them? And do other folks think of them as being worthy of wellness? Providers included. There's real stigma, there's perceived stigma. Folks who are worrying about the way they're seen as someone who struggles to pay rent or to keep a job, or who has drug addiction, or who needs to care for children, or who is um, struggling around just making a medical appointment and trusting the healthcare system. So there's so much to navigate in the healthcare landscape, and so many layers and so many factors that influence whether or not people are able to successfully access care, and ultimately what their health outcome looks like. So, what does HIV look like when the real antagonist, if we're talking in story language, isn't a virus, but it's the daily struggle to survive and the fight for a respectable reputation as a human.
Well, I don't really want to
Yeah.
follow Randevyn. Yeah, I think he said that so eloquently. But the only thing I will add, I think, in relation to what you're talking about of stigma, and sorry, Alston, I'll let you go in a second. Just wanted to note, I think also we don't really talk about, especially in the U.S., how much of a role geography plays in HIV. So Randevyn said that one of the misconceptions is that this is purely behavioral. You are living with HIV because of something you did, because of choices that you made, when really we often need to think about some of the reasons people are living on HIV are completely out of their control. If you happen to be born in the South, if you happen to live in a community that has higher rates HIV, you could be doing the same exact things as somebody who lives somewhere else, and your chances of getting HIV are substantially higher. So I just think that is part of the story that I don't think is really told, that HIV in the US is also a story. Randevyn talked about poverty and all these other kind of socioeconomic factors. Geography is a huge one as well.
Yeah, and then to add to that, and I think I'm okay to do this as a healthcare provider, to say that oftentimes, as Randevyn was talking about in some of the other spaces, when that is the antagonist, how about if that's your provider? When you walk in and you want to have a conversation about sexual health, about sexual wellness, ask for PrEP or prevention, and you can't comfortably have that conversation with a person you're supposed to be able to trust with your health care, right? You're supposed to, and not even you asking, you go into the doctor's office, provider's office, and expect them to tell you about the things that would be important for you to be healthy. And we have a lot of providers who just aren't comfortable having that conversation, and many times are not even aware of some of the advances that have been made. And so I think that's also another storyline that I don't think I've seen is, what about the provider who maybe is the one who is a bit of the problem and is not providing and has to be schooled or educated by their colleagues, or even in some cases the patient. And so I think that we see that. I do a lot of conversations, have a lot of conversations with different healthcare professional organizations, and bring this content and education to them. And I can't tell you how many times the providers ask the same questions that we said community is asking. Oh, that's still a thing? And I'm like, yes, you're a healthcare provider. You don't know that HIV is still prevalent in the US to the tune of, we have about 39,000 new HIV diagnoses in the US every year, just the US. And they are completely shocked to hear that. And so that's another piece of the story, right? Because that's where you would get your care. That's where you would be able to have a prescription or receive a prevention option. And they aren't aware or are not comfortable even having that conversation with you.
So they maybe don't even ask the right questions, the provider.
Correct. Yep.
I just wanted to jump in because Randevyn brought up something that we actually addressed in our Empire episode, which is just the faith-based community, and how, you know, the community that's supposed to be accepting and loving and can sometimes be the most judgmental, and we had it represented through a conversation between Cookie and her sisters. Her sister, her sister Candace, played by Vivica Fox, was the Bible toting, the church going sister who, you know, had this statements about how, you know, those people who, you know, who catch that, you know, they're irresponsible. And, you know, she told a story about a pastor, you know, who was, you know, sleeping his way through the congregation and ended up catching something, you know, like as if it's like, you know, I guess a response, a detriment to, you know, his bad behavior, you know. And we really wanted to showcase, you know, so many different perspectives as she was going on this journey to educating herself so that she could release the stigma and the fears that she was holding, you know. And a interesting story choice, you know, if anybody had watched the show, we knew how contentious the relationship was between Lucius and his son Jamal because he was gay. It was actually interesting to, at this point in the story, take Lucius, the character who lacked so much understanding for his son, be the person to actually give him understanding in this moment and trust his decision to love who he wants to love. So, yeah.
I think that there are, well, maybe I'll take a step back and wait for the next question.
Oh, go ahead. Go ahead.
I was going to say, you know, I think that there are a lot of interesting ways to sort of approach some of these stories around HIV, because the truth is that at this point, science has solved the problem. Thinking about folks who are undetectable and who have achieved viral suppression on therapy and are unable to transmit the virus, you know, science has worked to solve that particular problem, but society sort of refuses to let that go. Even a person who is medically incapable of transmitting the virus, as we're talking about education around HIV, they still face rejection. They still face fear, judgment, and dating and family and community spaces. And it's a powerful human story about love, about trust, identity, whether people can overcome what they've been taught to fear with new science and new advancements. What does that look like in a community that doesn't trust the healthcare system anyway? You know, where medical mistrust persists, where conspiracy theories persist, where healthcare hesitancy persists, when you have situations where folks who are virally undetectable are the people who are engaged last around sex and who are feared the most, and folks who don't know their status or are inconsistent on PrEP or don't talk about HIV at all are the folks that people feel safest with sexually. It creates a huge problem around the misconception of what it looks like to contract HIV and where the space of safety actually exists versus where people perceive it to exist. You've got a relationship, perhaps it's a monogamous relationship between one person who's HIV positive and one person who's HIV negative. And the community, they are technically, scientifically the safest in terms of what transmission looks like. But the community around them is talking about how they shouldn't be trying to have a baby. And you know, if we're talking about a male and a female, the community around them, if it's two men, are talking about how they're sure this other partner must have HIV because this other one does, when actually they are in the safest space not to contract HIV in a world of people who are having all kinds of sex. That is a reality that we don't talk about, that we don't address, that people don't believe, that people don't really know, that people don't trust. And so I think that there's a lot of opportunity to use the power of storytelling to bring that science to the forefront, to help people realize where their space of increased safety really is. It's in education, it's in information, it's in understanding and trusting and following scientific conversations, and then embedding that into your love and into your relationships and into the interactions that you have with your sex partners.
Wow. Well, you answered one of my next questions because I was going to sort of uh, ask about the mistrust of the healthcare system that we've certainly seen in Black and Brown communities for a long time with good reason. But now we're starting to see it bubble up in, all across the country, mistrust of vaccines and just the healthcare system in general. And I wondered if you're seeing that, and I don't know, maybe Dr. Dyson, if you see that in the folks that you treat, or either of any of you have seen that, where it's translated into that. And of course, what you were saying, Randevyn, about, denial. People just would rather be in denial and pretend like it doesn't exist, even though that puts them more at risk, which I think is so ironic and an interesting story point to think about for our writers. Dr. Dyson, do you have comment on that?
Yeah, 100%. I think we do see that still very often. And I am in the South, so I live in Alabama. So very heightened, in that area where you come in and you tell someone who in the space, in the place of prevention, they're not living with X disease, right? Or infection. And so then you come and say, hey, I want to give you this to prevent. And they're like, no, absolutely not. With this idea of you're trying to give me something, right? Like, not that you're trying to prevent. And it's just because there is that, historical, right? Mistrust, distrust that we've had, and things that have happened in history. And for good reason, people have that mistrust and distrust. And I think that's where, it's so powerful for all of us to come together and partner in these ways to have that conversation to build trust, right? And it's not always going to be the provider who can do that. Randevyn talking about the involvement of the community and how you get community involved in being able to have these conversations, right? And from a cultural lens and kind of that social aspect of things. And so that then helps drive and help create kind of some of that trust that you can see and build some of that trust. But also some of it does lie back in the fact that what I was talking about before with the providers who are not aware. And if I come in and I'm more educated than my provider is around, what's happening, then absolutely it's going to be difficult to build trust, right? It's going to be difficult to build that rapport. And so I think we see that often times. I can share examples of even in Alabama within my own friend circle, right? Asking me about PrEP, was knowledgeable. I had gone over all the options. She went into the provider's office, well informed of what she wanted. And the provider looked at her and said, why do you need that? What are you doing? And so now, how can I trust you, right? Like, how can I continue to have a conversation with you because you judged me off of really just wanting to take care of myself and be healthy, right? In that moment, so much trust was lost because of that reaction.
Wow. Oh.
I don't know if you got something, Bithiah, there, but I could build on it if you don't have anything to add.
Yeah, go ahead, Randevyn.
This is an interesting conversation that I've had many, many times with folks who help to develop our educational content for communities. And, the fact is, trust is not a gift that's waiting to be given. It's really a bridge that has to be rebuilt by the folks who help to break it. A lot of times we see the onus being put on communities of color specifically who suffer from medical mistrust and distrust the most. But the story isn't why communities distrust the system. It's whether the system is willing to earn their trust back. And generations, we know from studies in public health that generations can inherit mistrust in a moment, just teaching, upbringing, experiences, and rebuilding that trust can take generations. And trust grows slowly It grows slowly in the shadow of a bunch of promises, but it grows slowly. And the most powerful stories aren't about people refusing to trust. It's about what it really takes to understand why the mistrust exists and to make trust something that's possible again.
Oh, I love it. Well, this is in that same vein in terms of language, because if a doctor or a healthcare provider is using stigmatizing language, or outdated language that's not going to build trust, are there certain phrases, words, uh, that that writers and all of us, but certainly writers should be aware of in terms when they're writing about these kinds of topics?
There are so many. I don't know. Yeah, Alton, you want to get started? You want to go?
Yeah, and I'm sure you know where I'm going. I'm sure both of you will know what I'm going to say. Oh, I loathe the word risk. And I loathe somebody to say have risky behavior. Like, what is that exactly? Explain that to me. Don't yuck my yum, right? That's one of my things. Like, just because I receive pleasure in this way doesn't mean I'm risky, right? Because that word just sounds negative. It sounds dirty. And so when the provider or anybody comes in and says, "Hey, you're at risk," I'm like, "No, I'm not," right? Like, I'm doing what I would do in my normal life. This is who I am. Like, this is how I receive pleasure. How dare you? And so now the conversation is shut off. You can't have the conversation with me. And I think Bithiah mentioned it before that sometimes people's vulnerability is not wrapped up in their behavior. It is really wrapped up in the circumstances around them, right? Like where I live. I just said that I live in the South, right? And the South accounts for 52% of new HIV diagnoses every year. Alabama is a state where the entire state is considered an ending the epidemic territory because the prevalence is so high. So the mere fact that I live in this particular state, in this region of the country, right, is cause for you to have the conversation with me around sexual health and wellness, right? And so that's it. You don't need to come to me with this word risk. And say that you're risky or you're at risk. Come to me and talk to me about a reason, or what are the things that I need to maybe consider or we should consider together about why having a conversation about sexual health and wellness would be right for me. And that's the way to approach that conversation. So my biggest one that I loathe the most is risky sexual behavior, risky at like all of that. I just take that word and throw it in the trash is what I would love to see.
Well, it implies danger, right? Like, yeah, like
Yeah.
that interacting with this person is dangerous or that person is dangerous. Yeah, I can totally see. But
Yeah.
yeah, I think you have some others.
Yeah, I was going to say along those same lines, I think a word we hear a lot is infected. So and so infected somebody else. So it really is putting that you're putting this kind of that danger, right? You're saying because someone is living with HIV, they are a danger to others. So instead we talk about, HIV being transmitted. It's more of a neutral term. And the other one, I think just a big one, which, surprising, maybe not surprising, there's still a complete misunderstanding of HIV versus AIDS. The words are often used interchangeably, like, oh, don't do that, you're going to get AIDS. Like, so not understanding the very basics that HIV is the virus, that's what you're able to contract. So I think those are very basic ones. And then, I mean, I won't even get into, I'm assuming we're not going down that road, but just the number of stigmatizing words. Randevyn was very polite when he talked about how people write about things on dating apps. Usually the word you see a lot is dirty, right? They don't want to say, and like, only hit me up if you're clean. So there's so much stigmatizing language when it comes to the world of HIV. So I think just by modeling normal, healthy, loving, safe relationships and people living with HIV, we're doing a lot of good, because there remains this kind of inherent belief that a person living with HIV is somehow less than, they did something wrong, they are somehow, they're somehow at fault. So I think there's a lot of words we could get into. And Randevyn, I know those two on the top of my head. I know we've talked about this before. Are there any other kind of big ones for you?
Yeah, I think there are lots of terms that people are very, very sensitive to because of the history of HIV and how those terms came to be and the timeline in which those terms are associated. I'll give you just one quick example, and that is full-blown AIDS, right? People really have a reaction to that because of what it implies and because of the stigma that surrounds that particular term. There was a piece that I just wanted to share quickly. I know we're coming up on time, but maybe in 60 seconds, just to say this is something we don't talk about a lot. And it's not related to language. It's really related to the fact that HIV, yes, took a lot of lives, but it also took a lot of mentors and elders and storytellers and an entire generation of Black gay men whose wisdom never had a chance to be passed on. It's as a gay Black man myself, it's something that I've noticed that I've talked about a lot with friends in my life. When a generation of folks are lost to HIV, it's cultural memory, it's hard-earned lessons, it's countless stories that were never told. And one of the least discussed consequences is the interruption of that inheritance, and not even about financial inheritance, but passing down of those pieces of wisdom and that identity and resilience that turn into community knowledge. And so that could be part of the reason why we have a bunch of folks running around here now that don't really understand the impact and the significance of what HIV is, what it means, how it affects folks' lives, and how important it is to do what you can to exercise your options. There's that entire generation that was erased and was not allowed to become our elders. Really, it took something away from these younger generations and opportunities for them to rebuild parts of a cultural roadmap that was really key to living their best lives in many ways.
Wow, yeah, that's really powerful. And I do, again, because I was involved with the entertainment industry, in the middle of the onset of HIV, and Hollywood lost so many creatives and so many people, so did Broadway, and I think that's part of why, at least from my point of view, the television and film industry did embrace it pretty quickly because they were losing so many of their own, that they saw that this was an important thing to do. And of course, we saw lots of documentaries and an early Frost and some of those early films, Philadelphia and things like that, that really, were trying to tell that story. So, but you're so right. I mean, there was a whole generation, and I think it's not a joke, but there's about a decade of Broadway where all the shows were really crappy because we lost all the creatives, coming up with amazing Broadway shows. So, I want to go to JaNeika and JaSheika really quickly. Because you mentioned pushback. You got some pushback from, was that the network? Was it the studio? Was it the actors? I mean, I've had shows where actors have said, I'm not saying those words, not about HIV, but other topics. But I'm just curious, where did you get that pushback? How did you address it? And how did you finally get the storyline out there?
Yeah, I think if I'm not mistaken, it was the network, right? It was
Yeah,
the network. It
I
wasn't the
think
studio.
so.
Um, and how do we address? I think we tried to push back and educate them and tell them hey, this is whatever it was, but they were just
And we had it a couple of times with a bunch of different storylines. It was
yeah.
one of those things where the family on our show, they were like sacred, for them for whatever reason. And they just felt like we can tell the story, but do it this way. Anytime we tried to go directly to impact audience as much as possible, because the audience loved the characters so much, we just felt like it would be more impactful if we tell the story through our characters. But every time we would kind of go down that road, they would figure out a way to kind of diverge us and
Yeah.
say,
I feel like our actors would have been game for,
Yeah.
especially for telling a powerful story.
real powerful stories. Yeah,
Yeah.
they all were, and so, they pay the bills, they write the checks. So we have to follow suit. But I think we did it in a way that made it really powerful and impactful, and by introducing a character that the audience was able to fall in love with as Jamal was falling in love with him, and also to see two Black gay men have a happy ending and get married, I think, for the first time on screen was a big deal. In addition to him being an HIV positive character, it was really important for us. So yeah.
Can I
Yeah.
ask, did you get any pushback from your audiences? How did the audience respond to that storyline? Did that kind of give you leverage moving forward, or was the network like, "See, we told you"? So how did that part go?
No, it was the discussion was actually kind of very interesting. The audience was absolutely being taken on the journey and educated along with Cookie. And it was actually really positive, and obviously we probably had we had some, it was really
You had some people in Candace's corner.
Twitter was
You know,
hot and
yeah.
people were saying a lot, and could relate to the various perspectives.
But for
But
the most part, I
overall,
feel like people were being educated. And I think because we took them, we had the main character, Cookie, who was so beloved by audiences, kind of having that discovery of her own, it allowed other people to be just as open to discovering it, as well. And I think that is what really was
yeah, it
being
helped to
so
go a long way.
impactful.
Yeah.
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 I love that. That's what I hope you would say. I think, having that audience stand in is really helpful for people's experience. So I love the way you guys handled that. Thank you.
Yeah. Well, what do you think? This is for everybody, including our writer producers. What are or have been some of the biggest missed opportunities in storytelling? Um, I mean, particularly of late, because again, I feel like we're in a little bit of a dip of HIV stories, and that might be because many people feel like, oh, it's not a thing anymore, or it's just a chronic illness and there's no drama there. So are there missed opportunities? I know that there, the geography thing is really interesting because there are some shows that take place in rural parts of the country. And to me, that seems like a perfect opportunity to not only do the geography piece, but also the healthcare provider might not, their own ignorance in that. So I don't know. Have you been watching something or reading a book or something and thinking that's a perfect opportunity they could have used for, some HIV education, or I hate to say education, but storyline.
Yeah,
Anything come to mind?
I'll start. I think there's a number of shows, maybe because I have young teens. I'm always looking at shows that are kind of like high school, college age, and I'm always fascinated again about how much HIV is not a part of the conversation. And I think there really is an opportunity to tell the story of, especially young people who were born with HIV or people who have been living with HIV for a long time. What that transition period is when you move out of your home, when you stop seeing the pediatrician or the doctor, your provider who you've been seeing your whole life. What does that mean? I've talked to young people who take what they call kind of a medication holiday because they go to school and they've been feeling good their whole life because they've been treated and been feeling well, and they don't want to move into a dorm with a bottle of pills. They do not want anybody on campus to know that they're living with HIV. They do not want that to be a part of their identity, so they just choose not to take their medication. There will always be consequences from that. So I think that's part of the story, is kind of what is that, and then also thinking about what Alton talked about, having, because we have different medication options, if that person knew about a long acting injectable option, you can do that when you go home. No one has to know. So that's part of the reason that, that methodology, that way of treating HIV is such a big advancement. HIV has come so long. There is a daily pill, but we talk to people that a daily pill is still a daily reminder. And for some people, it's a reminder of something that for them might be one of the hardest pieces of their lives. And so people talk a lot about not needing to have that daily reminder. But I think there's something really interesting about that, young people, when you're starting on your own and you're dealing with something, and how do you start to manage that? How do you manage a love life? How do you navigate all those first experiences while also dealing with something that for a lot of people they still have shame attached to it, for all the reasons we just talked about, from their church, from everything else. There are all these things that kind of have people sometimes starting with that self stigma that takes a long time to grow beyond.
I think there's a lot of missed opportunity, unfortunately. And just speaking from a business perspective, as a creative, like there's miss audience. We're not captivating certain audiences that are literally interested in following these stories. I think so much of the word trauma is like, associated with,
Yeah.
health things on television, and I just want to just remove the stigma of the shame, the trauma, and just let's normalize.
Let's tell a different story.
Let's just normalize telling these stories. There's a content creator that I stumbled upon on YouTube. I think she tells her story about has at least 400,000 followers, and it's telling her daily story about her life continuing to go on after she was knowingly infected with HIV by somebody she was engaged to. She's no longer engaged to, went on to fall in love, got a husband, got married, had her first baby, is on her way to having her second baby. And she is literally talking about her story to remove the stigma and to show that like
there's
life
Yeah.
still goes on and how beautiful it can be. And she has a following. So I'm saying just from Hollywood perspective, we're missing out on audience to be able to share these stories with because of
I mean, we've had this at various times in the Empire Writers Room because of the way that you want to tell that people like to assume the story should be told as opposed to
or
saying,
assume that the way that audiences can receive certain stories.
Exactly.
It's just like, yo, like
we can tell it, we can be fresh, we can remove the dated tropes that we've seen time and time again because there are new ways to educate people, but also to entertain them about this and a way that they can just
experience new stories. So
yeah, I think it's also it takes me to the reason why we need more diversity in the writers' rooms. We need more diversity in the executive suites that can greenlight shows that are reaching audiences that certain executives might feel are not worth reaching. And yeah, so I mean it all comes together with a lot of other issues, right? And how these stories get told, how they get made, how they get aired or put out there so people can experience them. And one thing, certainly, the younger audiences are not necessarily on linear TV anymore. You know, they're watching on YouTube and and I think that's really empowering for people to be able to create their own content, put it out there and find their own audience. I think storytelling is really powerful and we need to, and I don't ever want to see linear TV or movies go away, but it's just another area that people can find their tribe, so to speak, and hear stories that they might not hear on broadcast television because of the constraints that broadcast television is under. Okay, well, it's almost time to go for questions, but I have one other question, and then we'll open it up for the audience. And that is a lot of medical shows that we work with involve the emergency room. So they're always looking for stories that can happen in an ER. So if Dr. Dyson or others, are there stories that you can share, case studies or, you know, clients or patients that you've had, obviously no names needed, that, you know, involve an emergency room? How can we get the new treatments, the new, you know, all of this into the emergency room, so to speak?
Yeah, happy to jump in. And I think I shared maybe this when we spoke before that, so again, being in the South, I remember very vividly a patient that we ended up seeing in our clinic who had engaged in the emergency room because that was the care that this individual, where they received care because they didn't have primary care provider. And they had engaged in the emergency room 3 to 4 times in a year's span because they kept coming in ill, with different symptoms, things like that. And it was only after about the 4th time that the team decided to consult ID. And the ID physician came in immediately and said, have you provided or offered an HIV test? And they had not. And he said, that's the first thing that we need to do is provide an HIV test. He said, you've consulted me, but there is not another infection. I can look at the presentation of the patient now and tell you that I would 100% almost bet money that they are living with HIV and advanced HIV at this point. And sure enough, the test came back positive. And so over the course of these 3 or 4 times that they had engaged in the healthcare system, right, in an emergency department, had not received an HIV test and now had advanced HIV and now a CD4 cell count that was below 50, well below 20. So now having advanced HIV. And so now having to kind of come out of, if you will, kind of this place and try and get this place to return to health. And so that to me, and we all talked about it in clinic, and we talked about how as a healthcare system, it felt like the healthcare system had failed this individual because it had been multiple times and there were multiple entry points and opportunities to provide an HIV test because, again, living in the South, in this case, was a male, under the age of 30 who nobody had even asked, are you sexually active, right? And that was the only question you really needed to ask. You didn't need to know about all the different partners or who they were. What you know is that in your particular region of the country, prevalence is high. This person is sexually active and of an age of where, where they are being sexually active, right? And enjoying life. And nobody thought to ask the question about, let's get an HIV test. And because of that, ultimately, just looking at the disease progression over time, ultimately ended up with advanced HIV. And so multiple times in the system could have prevented that, but we didn't, right? So I think that's one that I think of all the time, and there have been instances as well where people have come into the emergency room, again, not offered, HIV testing or STI testing at all. And then, doing fine, and then come in later and now being diagnosed with HIV. And so could have had an opportunity there where they could have been tested, found to be negative, and could have been offered prevention to prevent transmission of HIV, but it was never a conversation. So I think there's two things here. We can diagnose people, but we can also have someone who's negative and be able to start that conversation around prevention. Because oftentimes what we find is that there are people who don't have primary care providers, and this is their way and their entry into the healthcare system. This is where they receive healthcare in urgent care and in an emergency room. And so you have to take on sometimes that primary care role and be able to have those conversations for folks.
Yeah, I mean, it's just it's an affordability issue and a health insurance issue. As Randevyn was saying, that it has to do with poverty. It has to do with so many other things, not just whether you're HIV positive or not, and how you're going to stay that way. So I'm gonna. Randevyn, you moved from the lower part of my screen to the upper part of my screen. I thought you went away there for a minute.
I thought maybe I'll just take 30 seconds to add something that we've not talked about.
Sure, go ahead.
Not leave that on the table.
And I'll just say, if people have questions, there's the Q&A function. You can add questions or you can put them in the chat and we'll see if we can get to them. Go ahead.
Yeah, thanks. One thing we've not talked about is HIV criminalization, and I think something important to recognize is that the science, has moved on since the onset of HIV, but a lot of our laws have not. And so you've got folks who are virally suppressed and are not able to transmit HIV who are doing time because someone was afraid, of the sexual encounter. And because of disagreements about disclosure, when to disclose, how to disclose, whether or not to disclose. And so, there's a huge issue there, a sort of a justice issue there that I think can also be addressed and shared. To Alftan's point around the ER, what we've seen in recent years sort of mirrors what we've seen in years past around, in the beginning, at the onset of the epidemic, we were struggling with HIV being addressed or named at all, and to get resources and to get the science community invested. And then we had, many, many years when we had resources, we had the government that was committed, and we had all these programs. And now what we see is some sort of repressive legislation that is really cutting a lot of dollars from HIV prevention. And, what we fear as a public health community is that we will not reach our goals, our 99 or our 95, 95, 95 goals of 95 folks, percent of folks tested and knowing their status. And then that 95% of folks who are in care and 95% of folks who are able to get to viral suppression. We fear that we may not be able to get there because of the $1.7 billion cuts in HIV prevention, which then does lead people to have even more access issues, which does then land folks in places like the ER, presenting with an AIDS diagnosis. So then, it's important to understand the elements of the story and how one piece leads to another, and every dollar cut from prevention eventually shows up somewhere else in the healthcare system. So I think that that's something that's really important to recognize. And when people have significant access issues, maybe access the ER, maybe don't access the ER, but there are lots of stories, some of which I was able to share in an op-ed that I did with Harvard Public Health Review around one of those stories, in which around a man shared how one of his very good friends died on the floor of an apartment from complications of AIDS because there was an ADAP waiting list that he could not get on in the state of Georgia. So there are lots of stories to tell. There are layers and buried under layers and layers and layers of subcultures and subcommunities that are not recognized or respected for the barriers to health and wellness that they have. So lots to uncover there, lots of stories to tell there, and lots of insight to bring to what can be impact later
Hmm. Well, we have a couple of, here's a question. It says, can you address women who contract HIV? What's the cause of the high numbers of women having HIV?
I mean, I'm happy to jump in. I think one of the things is something that we talked about, already quite a bit, is the piece of perception of risk, right? And so that's the other reason why that word is not my favorite, because someone saying to me that I'm at risk for HIV as a woman when my risk perception is low, right? Because when we think about certain communities, right, there's still this perception that the only people impacted by HIV are gay, bisexual, LGBTQ plus community, right? And so that's not me. So I'm not at risk, right? So that risk perception is very low because of who we picture or who we think is, at risk or vulnerable, right, to HIV. And so I think that's one thing that drives it. I think the other piece is just no one's having a conversation with women around their vulnerability to HIV. And so when we think about this, and we've talked about ERs, but when we think about this, a perfect place to have a storyline around an OBGYN who could have this conversation, because you talk to women about preventing pregnancy, you talk to women about preventing other things, right? We do our pap smears for, also a viral infection, right? That we're trying to prevent. And why is this not a part of that conversation as well? And I think, there's multiple stories you could talk about with that. Even my own experience. My provider said, hey, who should I talk to about, PrEP? Who should I talk to about HIV? And as you heard Randevyn say before, the only people that she thought about were people who had a partner who was living with HIV. She said, I only have one, couple in my practice that she knew of that is serodiscordant. And so I asked, well, do you know the partner's, viral load? Are they undetectable? She said, oh yeah, they're undetectable. They're seen in your clinic. They're doing well. And I said, well, that's probably, as Randevyn shared, probably scientifically the one couple who maybe doesn't necessarily need to have the PrEP conversation. And I turned and I said, would you ask me? And she said, no. And I said, well, why not? I have an IUD. And so that means I want to prevent pregnancy, right? And I said, how do you get pregnant? So then how do you also, get an HIV diagnosis? She said, well, oh. And so it was the light bulb that went off. And I think that that's also the power of the storytelling in some of the work that you all could do is providers watch your shows as well. And so if the provider is watching the show, a light bulb could go off for them that, oh, I should.
Oop, we
Oh
lost her.
no. Yep.
on.
Well,
You can pick it up.
I was gonna just give a little shout out to How to Get Away with Murder too, because we worked on that storyline, and it started with the Connor and Oliver going, deciding to take their relationship to the next level, and Oliver kind of insists that they go get tested and everything first, and they do, and of course, spoiler alert, it's not Oliver that's HIV positive, or it's not Connor that's HIV positive, it's Oliver, and they have to then, they have the conversation about PrEP and the whole thing. But we saw so much interesting input on social media, excuse me, about one guy posted on Twitter that he saw the storyline on How to Get Away with Murder, and it reminded him that he needed to go get tested again. He hadn't been tested in a while. So he goes down to the clinic and he tells the nurse, first thing in the morning, is New York City, goes to the clinic, tells the nurse, oh, I was inspired because there was this episode on How to Get Away with Murder. And she looked at him, and they had only been open an hour that morning. And she looked at him and said, you're the fifth person this morning who's mentioned that show. And this clinic had only been open 1 hour. This is New York City. Back then, the show was getting, 11 million American viewers. I wish I had had the funds to study, clinics around the country to see who else. I mean, those are the people who mentioned the show. How many people went and got tested that didn't mention it to the nurse? But I just, it's anecdotal, but it's super interesting on how these stories can really inspire people to, take action in their own lives. And so, for all you writers out there, we're hoping you're going to find this as inspiration. And I know JaNeika and JaSheika are going to go create a show now, and it's going to be a huge hit, and it's going to be, we're going to have lots of opportunities. One last comment that was in the Q&A isn't really a question, but it's just that Joe Hogan says, thank you for the topic and panel in regards to community and geography. Documentary filmmaker Zeb Newman, along with executive producer Cheryl Lee Ralph, in their 2025 Hulu doc called Living Proof, they illustrate women in the South traversing the healthcare system and stigma with HIV. And I know that for Cheryl Lee Ralph, this is a really important issue for her. So appreciate that good work around that. Any final comments from our panel for the writers in the room? And here comes Dr. Dyson. She's back.
Um, maybe I don't know, Dr. Dyson, if you want to finish your statement, but I guess I'll just, while she's logging back on, I'll say that lots of opportunity here. Such a story, of so many parts of the human experience. I'll say that many of us like to imagine that our relationships, whatever their nature, exist in isolation. But we know that the truth is we're all connected by this vast web of human intimacy, and not everybody honors monogamous agreements, and our health is often shaped by choices that are made far beyond our control. And I think that there are stories to be told around the way that we see ourselves and our love and our relationships and our connectedness, and how all of HIV is a part of that entire story. And as far as we have come, it proves that we can go so much further, with conquering stigma, which is really the biggest challenge here. And storytelling is one of the most significant tools that we can use to get there.
Absolutely. There is, I'll ask for 2 words or less for a takeaway for our writers. Anything like, if you had to just pinpoint it all in one thing, what would you want writers to remember from today? And then also, just as people are getting ready to take off, we're going to put a link in the chat to let us know what you thought of this panel. Please take the survey and let us know. We'd love to know. And also, we will repost our tip sheets for anybody who came in late. If they didn't see the tip sheets, we'll repost them so you can download them and use those as well in your projects. And so I'm going to just round robin it. Give us one thing to remember for our writers. I'll start with Dr. Dyson.
Normalize the conversation. That's it. That's me. Normalize the conversation.
Great. Bithiah.
Well, and I have to thank again Alftan stole mine. Let's say U equals U. I think the undetectable story still hasn't been fully told.
Totally agree on that one. I think U equals U is understood. People don't get what that means. So that's a wonderful one. Yeah. JaNeika, JaSheika.
One. I was remove the stigma. Remove the stigma. Yep. And the shame.
Great. Randevyn?
Maybe I'll just say that the first word in HIV is human. These are human experiences, human connectedness, and human stories.
Way to take us out there, Randevyn. That's wonderful. Well, thank you everyone for joining us today. Thank you to our panelists. I think this was fascinating conversation, and I know we're going to inspire some great storylines in the future. As always, writers who are in our audience, you know you can reach out to Hollywood Health and Society. If you want to talk to any of the folks here on the panel, we can arrange for that. If you want to talk to people living with HIV, if you want to, whatever it is, we're here to help you develop your storylines. Our services are always free. So, there's no reason. And please, I beg you, don't go to Google. Come to us. Google might be good for some things, but there's still a lot of mistakes out there. And so if you come to us, you will get people who are working in the front lines of this issue, like our panel today, and we'll make sure that you get accurate information. So feel free to reach out to Hollywood Health and Society. Again, thank you, Dr. Dyson, Bithiah, Randevyn, JaNeika, JaSheika, and all the folks at ViiV Healthcare and all the folks at Hollywood Health and Society who have helped to put this thing on. There's all kinds of people working in the background, making it all look good. So appreciate everybody and have a blessed rest of the day.